Hello, everyone, and welcome to the Digital Health Wire show. My name is Jason Berry, and I'm the editor of Digital Health Wire and the host of the show. Today, I'm excited to be joined by Bill Paschall, who is the SVP of Growth at ClearArch Health, which is the remote patient monitoring division of Mobile Health. Bill is a bona fide telehealth veteran who's going to help us dig into the biggest changes happening in remote care, as well as the trends driving them forward. Bill, it's great to have you here.
Thanks, Jason. Happy to be here today.
Bill, before we get too far into the weeds, why don't you share with the audience a little bit about your background and kind of the story arc that led you to your current role?
Yeah, so I've been in telemedicine for a long time. I guess I like to say I'm vintage, uh, which keeps it a little fresh. Um, but I started out, my dad's an MD, so I started out in medical sales, went to a company that had developed a video otoscope, for looking in the ear, primarily for audiologists, and went to my first telecon telemed show that was right at the inception of American Telemedicine Association. So over 30 years ago. Worked with that company for a while, went to a telemedicine company called the AMD, a Global Telemedicine. They're still around today. Ran the western half of the US for them. After that, went to AT&T as Director of Healthcare Applications and working in their 4Health group for about 6.5 years. Then went to a startup called Vivify Health, which was a remote patient monitoring startup. Was there for about 9 years through that acquisition by Optum, stayed on a couple of years after that, then been here at ClearArch Health for a little over a year and a half. Been involved with American Telemedicine Association for a long time. I'm a fellow of that organization. I'm also chair of their remote monitoring special interest group. We'll talk about that a little bit more when we talk about ATA Nexus coming up in a week.
Perfect. So you have a rare vantage point where you've seen telemedicine evolve not only during the pandemic, but prior, you've gone through several cycles prior to that. How is it having such a high perch to look at kind of the industry from?
Well, I started out in a low perch, but maybe I've come up a couple of branches since then. But it's been an interesting, exhilarating, and challenging roller coaster ride. Sometimes the rolls have been slow, and sometimes pretty fast.
Hmm.
Especially when you look at what funding is available, what's happening. So pre-pandemic, we had CMS approved some CPT codes for chronic care management. And then in 2019, remote physiologic monitoring. So
Mhm.
just before the pandemic hit, which was the largest facilitator of the adoption of remote technologies, telehealth, telemedicine, and remote monitoring that anyone could have ever anticipated.
Mhm.
So interest rates were low, money was pretty easy flowing into the space. So that generated a lot of competition, which now we're seeing some of the effects of that.
Mhm.
But in COVID, CMS did 134 telehealth waivers to accentuate the use of telehealth and remote services. Remote monitoring was part of that. And now we're hoping to see a lot of those made permanent before the end of this year to keep that train running, so to speak.
Exciting times to be a part of it. Can you kind of give us an overview of where ClearArch Health fits into this market? Walk us through the platform, walk us through who your customers are and how you're serving them. I think that would be a good foundation for the rest of the conversation here.
Yeah, happy to do that. So, ClearArch Health is the healthcare division of Mobile Health, as you mentioned earlier, which is a personal emergency response system and fall detection company that started out with cellular based solutions for those markets well over 15 years ago. And that market sells direct to consumer,
Hmm.
right? So, all of that market is direct to the consumer. Then that's backed up by a tremendous call center that provides those emergency urgent care services, escalates to 911, or resolves those calls within the staff of that call center.
Mhm.
Then about 7 years ago, launched ClearArch Health, the healthcare division, which is B2B. So we sell to the provider market and sell remote patient monitoring integrated with PERS and fall detection. We acquired a tremendous platform that had a lot of maturity, been around, a lot of customer base, a lot of satisfaction, good user interfaces. And it was originally the Honeywell home med solution spun out then to Residio. We acquired that as our basis of our platform, have been working really hard the last couple of years to increase its functionality, for the current market. So a great base, both in our platform base and in the business base, and then moving all of that into the modern use cases that we're seeing now, for now in the future for RPM.
If we look at the individual hardware and software solutions that kind of comprise the platform, what does that look like?
So I think one of the things that differentiates us as a platform is flexibility. So we have many different modalities that our customers can select in how they are going to provide care for their patients, and whether that's chronic patients or post-acute patients. So we have a bring your own device solution, which can operate as a deviceless RPM. So just a
Mm,
messaging capability through text and even email messages to the patient. So deviceless RPM.
mhm,
Then the bring your own device solution, that mobile app, can simple pair Bluetooth devices to it. So it's a more full function remote patient monitoring solution that can be used in conjunction with our PERS solutions. Moving up from that, we have a hub. So a simple hub, no screen, just a few buttons. It also integrates via Bluetooth to the list of devices, personal health devices that we use, biometrics or peripherals, whatever that term is you want to utilize for that. Everything from weight scale to glucose to thermometer,
mhm,
even spirometry in that, and other devices. So that hub can also be the hub for personal emergency response and fall detection. So there's a hub
mhm,
for that and a wearable that then is combined with our RPM solution in a simple hub. Then we can move to a tablet based solution, which we see a lot in the market from us and from other companies with video based user interface on the tablet, usually locked down. We manufacture our own tablet and we manufacture our own hub. So that's a real advantage for us in the market because we have supply chain control. We have operating system control. We have Bluetooth stack control. We have things as simple as volume control and a built in stand and a durable built on case for the tablet. So we can control all of those things.
mm.
So we have that. Then we have our single platform that, of course, does trending, and then we can do integration to HIT and other things. So a real clinician led for development
Mm.
user interface on the clinician side of things.
When we look at those end users of the platform, either the patient or the clinical care teams, what are some of the advantages of having that flexibility to kind of right size the experience for all of those end users? Can you talk to us about that?
So it's not an all or nothing. We have customers that utilize a portion of their patients with bring your own device or mobile app BYOD with
Mm,
that. Then we have services integration. So how do we want to utilize the services that can be offered for clinical monitoring and management of the patient? Does the customer want to use their team? Do they want to use our team? We're flexible in that.
mm,
Logistics. Does the customer want to do their own logistics? Do they want us to do logistics? Do they want a kits on the shelf model? Do they want us to ship and collect direct from the patient? So we've got all of that flexibility and that type of integration into our logistics platform.
mhm,
And then, of course, there's HIT integration, primarily into electronic medical records. Chronic care management has to be built from a certified electronic medical record. So that's much easier if we are just integrated fairly seamlessly into that solution.
mhm,
Then we can, so that's HL7 or API integration or Fire integration for some of the more modern, easier, and usually two-way integrations. We
mhm.
do that. So we are able to integrate into any of the electronic medical records out here on the market and have integrated into most.
What's it been like kind of witnessing the evolution not only of these interoperability standards, but also just the recent evolution of how those have helped make more use cases possible within general virtual care, within remote patient monitoring?
So when COVID started, what we saw was a huge upspike in telehealth for that
Mhm,
episodic care. But
mhm,
then if someone had COVID, now what do we do? How do we monitor that patient over time for more durable
mhm,
monitoring? And CMS made a change in one of the device codes, 99454, that if a patient had COVID or was suspected of COVID, you only needed 2 days of data within a 30-day period in order to bill for that code. And then you could bill for the service codes on that 99457 and 99458. So CMS was pretty quick to do that. That ended May 11th of last year, when the pandemic was over.
As someone who's so tapped into all the regulatory happenings, I'm curious if you had a magic button on your desk and if you pressed it, you could change one healthcare regulation in the US. What would that button do for you?
Oh, just one? I only get
I
one?
know it's going to be a hard
Oh
pick for
my
you.
gosh. Man, that one is really tough if I just get one.
You can have two
Can it
buttons.
can it just be one thing?
It can
Okay.
be one, it
Okay,
can be
one
one,
button.
it can be one theme. Yeah. Maybe two.
Okay. Well, one button is going to increase the reimbursement rates,
Mhm,
or the RV. If you get that down to that increase in the RVUs,
mhm,
that are used to calculate what those rates of reimbursement are.
mhm,
If you are really doing remote patient monitoring right, and we've built a pretty substantial ROI tool, and we get into a lot of the minutia on the regulations and what they pay and how they pay and who what percentage of your population is going to qualify for that.
mhm,
um, you're you break even and you make some money, but you don't make the type of money that we see on some RPM company websites ROI tools, which is just best case scenario. So
mhm,
we try to be really realistic on
mhm,
expected returns with our customers so they're not disappointed, and we're just,
mhm.
it's not a negative. We just keep running down the road, and well, with the proper expectations.
Right.
So increase, so my one button is increased um, reimbursement all around. Boop,
Mhm.
hit that easy button. The other one wouldn't be a button for a specific code, but it would be when CMS comes out with a code or codes like they have, that there is more clarity around that code and its
Mhm,
utilization. So
mhm,
G0511, for example, now that can be used by FQHCs for um, reimbursement for telemedicine. Okay. Do you have to meet 99454 and 99457 in order to use that, or do you not? So that's just an example, but more clarity around the codes, because what we find is we've got all these codes and we've got the list, and we can show how we've built the tracking for those codes into our software, so you know who that you can, out of your population, you can bill.
mhm,
But there's reticence on the part of the providers because they don't want to bill CMS, get paid, and then in an audit or something have that
mhm.
taken back from
Right.
them. So I will say, across our customer base, of those who are eligible to bill, probably only 15% are
Mhm,
billing
mhm,
because there's still trepidation. I mean, there are telehealth attorneys and attorney groups who
mhm,
focus just on these things because it is so complicated.
mhm.
So, an
Yeah.
easy button to make it easy.
It speaks volumes when one of the magic buttons is just not even impacting the regulation itself, but just asking for more clarity that these providers can use to know whether or not this code is for them. Can they use it?
Yeah. And
Are
so,
there
not just
any,
that's, and
go for it.
yeah, and I would say, so that's not just on the provider side. So
Mhm,
as chair of the remote monitoring special interest group at ATA,
mhm,
we have other vendors come in with questions, in addition to people who are running programs and
mhm.
providers. And
True.
the vendors will say, I've got this great solution. We've been told to bill that this code could bill it, but we're not sure, so we know we've got this cool thing, but we don't even know how to tell our prospects and customers what code to use to bill it.
Right.
So it's complicated on all sides.
Mhm. Very, very true. Very true. Um, Maybe to shift gears a little bit, are there any components of a successful remote patient monitoring program or platform that you feel might be either overlooked or kind of underweighted when different people are thinking about them?
Yeah, I think there's two that I think about. I mean, we've talked about flexibility, and that's a big one, but I'm going to leave that out of this. I think maturity and structure. So
Mhm.
when I say maturity, I don't just mean that it's an old company that's been around for a while, but someone who's a team, an internal team with expertise on deployment and implementation.
Mm.
So um, even in pre-sales, starting to have clinical team discussions, from the vendor to the customer on what are the use cases, how are you thinking of enrolling, is relating, what's your escalation path, and having a company that can give guidance or thousands of customers on what are best practices in those areas. And then in implementation, who can do a smooth implementation with training, with different modes of training, online training, in-person training, recorded trainings. We see a big move to a lot of automated training, but I recently last week was looking um, at a study, and it was that the customers re- desire more one-to-one in person or one to group in person training, and a little bit less of the automated online training. So you've got to keep those kind of flexibilities there. The other thing is structure. And so when I say structure, I mean business structure. Of course, you want a company that's financially stable, that can show that it's been around, has customers.
Mm.
But in the business structure, how is the remote monitoring company providing you the solution and platform and devices, if you want devices? um, what's that model? It can be a purchase model, it can be a lease model. What we primarily do is platform as a service. So for one fee, it's the hardware, it's the software, we can bundle the services, whatever that level of service is in, and you're paying out of a pool of equipment. You don't own the equipment, you really don't even lease the equipment. You're just paying a usage fee per month on the actively used equipment that you have out in the field.
Right. What advice would you give to a provider organization or to a healthcare organization in general thinking about spinning up their own remote patient monitoring program or maybe overhauling the system that they're struggling with that they already have in place?
Please call us today. Really, please call us today. um, so there's a couple of things. Not only us, but I'm sure other remote monitoring companies have already replaced other vendors that
Mm.
customers have found, "Well, this solution just is not a fit for them." Rip and replace is a term that gets used that might sound like it's a horrible experience to change from one vendor to another or one platform to another. But with a good transition and flow, that is not as painful as you might think. And we've had many successful transitions into our platform from
Mhm.
other platforms. So a lot of transition going on. We're very familiar with that, and have been successful with that. So that's not as hard as you might think. Talk to vendors earlier than later.
Mm.
We see a fair number of RFPs that are put out, and sometimes you can identify, well, they talked to this one vendor, and that we can see some things in the RFP that let us know that. So talk to a couple of vendors in the space before you put out an RFP, if that's your path. And especially, I mean, we're still finding people that this is their first remote patient monitoring program or project experience.
Mm.
Um, so be open to the expertise of those that have been in the market, even if they are a vendor. We have quite a staff of RNs who have come from the industry and been in telemedicine and remote patient monitoring for quite a while. So they've got valuable insights. There may be other ways to accomplish what you want to accomplish than you've kind of got written down in your outline. So just be open to suggestions,
Mm.
even if it's from a vendor. We're not always the bad guys.
So I want to make sure that we leave no stone unturned here. I'm sure there's other areas that you're excited about, and you'll be at ATA Nexus this week and next speaking on some of them. Can you give the audience a sneak peek at some of the things you're excited to talk about and what you'll be sharing at the show?
We are going to be busy there. So our booth is 1117. So come by and see us at our booth Monday morning. the special interest groups from American Telemedicine Association are having a breakfast. Anybody can come to that. You don't have to be a member of a special interest group, and they're broken up into the different tables. So remote monitoring will have a table or two, and we'll have a roundtable discussion on some topics that we've selected for that. Later Monday, I think at 12:20, near the SIG hub, which I'll be spending some time at. So there's a little hub for every different special interest group in American Telemedicine Association, where you can come and learn about that and decide if you want to be a member or join one of those. Then I'm doing a little 10-minute discussion on that. And then we have Tuesday, we have a SIG meeting, which is a meet and greet. So that would just be, see it in the schedule, in the agenda, and show up for that if you want to meet and chat. So a lot of stuff going on over the several days of American Telemedicine Association.
Bill, first of all, this conversation has been absolutely fantastic. I appreciate you shepherding us through some of the trends that you're seeing, diving into the regulatory stuff and the new tech here. Is there any final thoughts here that you want to leave the Digital Health Wire audience with before I let you get to it?
I would say if you look out in the market today, depending on what your viewpoint is, you're seeing that kind of tightening and restriction in the market. We're seeing that a little bit, but the growth potential is phenomenal. Remote monitoring is here to stay. The population trends, which, baby boomers aging is going up 10,000 a day still, I believe, or close to that, hitting 65 a day. The number of physicians and clinicians is declining, and those near retirement ages, there's a pretty good bump there. So the only way to meet that disparity in the number of people who need care and the number of people who can provide care is the appropriate use of technology and human intervention, and remote monitoring is a great way to do that.
Well put. And what a great note to wrap the show up on. Bill, it's been a pleasure speaking with you. Thanks, everyone.
Thanks.
Thank you, Bill. Have a great day. That's been the
All
Digital
right.
Health Wire show. Thank you all for joining us, and we'll see you next time.